everyone, and welcome to the Surgical Ergonomics podcast, where we will be discussing everything related to surgical and procedural ergonomics, the people, ideas, and technology that will help enhance your physical wellness and career longevity. I am your host, Geeta Lal. I'm an academic endocrine surgeon, speaker, consultant, and surgical ergonomics coach. Having experienced work-related musculoskeletal injury myself, I am committed to increasing awareness of and developing solutions to counteract the impact of poor ergonomics on the professional and personal lives of healthcare workers in procedural areas. This episode of the podcast is sponsored by Pearson Rabbits. For many of you, your career is your calling, so don't let an unforeseen injury or accident take that away. Pearson Rabbits, a firm founded by a physician, specializes in disability and life insurance tailored for healthcare providers like you. They understand the risks you face and offer real education and guidance. It's about more than a policy. It's about peace of mind. Head to surgicalergonomics.com/podcast/ and click on the Pearson Rabbits logo to take the first step in protecting your future. Hello, everyone, and welcome to another episode of the Surgical Ergonomics podcast. In this episode, I'm really excited to have as our guest Dr. Linda Miller. Dr. Miller is the CEO and founder of EWI Works International, Inc., Western Canada's leading ergonomics and wellness company. With more than 35 years of experience in ergonomics and occupational therapy, Dr. Miller continues to lead EWI Works into new territory, particularly in tech. She has extensive experience in healthcare ergonomics, and recently she and her team developed a markerless motion capture system called PoseChecker, designed to analyze worker videos to determine the level of musculoskeletal injury risk associated with their work activities. Dr. Miller also has a passion for education and empowerment, which is reflected not only in EWI Works products and services, but also in her position as an adjunct professor at the University of Alberta's Faculty of Rehab Medicine Department of Occupational Therapy, where she is part-time clinical lecturer. For our listeners, I also need to let you know that Linda is actually my business partner, and we've been doing a fair amount of ergonomics coaching together, also using PoseChecker. So hello, Linda, and welcome to the podcast.
Hi there. How are you today?
I'm good. Are you ready for us to get started?
Yeah, ready.
So for our listeners, Linda, I know your story very well, but I was hoping you could tell our audience a little bit about your training background and how you actually came to be interested in surgical procedural ergonomics, and how did we end up partnering together?
Well, my background started in occupational therapy, and shortly after I went into clinical practice, I was starting to get very interested in more the prevention side. So I ended up doing a master's in environmental design. And then shortly after that, I actually went into private practice with EWI Works. And all through that time period, I was working with heavy industry, lots of healthcare projects. And we were really starting to see a lot of musculoskeletal injuries and starting to find out there were fairly common causes. And so that was the real target for me, was to look at how we could redesign jobs, how we could introduce new equipment, and really start to reduce the risk on people performing their work. So that was the first initial, probably 10 to 15 years of my practice. After that, I did a number of projects in a number of our hospital systems here in Alberta. And I was starting to see a couple of surgeons, and I was starting to see very similar issues that I'd seen out in industry. And they were holding very static postures, often talking about excruciating pain in the lower back and the neck. And so I thought, there is another opportunity. We've done a lot in nursing, but we hadn't done a lot with surgeons. And then in the pandemic, it was interesting. We actually met, and we had the opportunity to work on our passion together. So it really complemented what you were doing in your clinical practice, but also in your business. And then I was able to take a lot of the lessons learned that I had from industry, but also healthcare, and start to ask, where is the opportunity here that we can actually start to really shift people's health, and
Yeah.
specifically in the OR.
Yeah, yeah. No, that's absolutely right. Actually, it's interesting that you mentioned that we met during the pandemic because I had forgotten that it had been that long, and my Facebook feed threw up a memory today, in front of me, and it was the first talk I gave in surgical ergonomics, grand rounds at my institution, and that's probably around the time that I started to have an active interest in sort of reaching out to various people who were interested in ergonomics on LinkedIn. And you were Canadian, and it's so you know how these programs show you people you might connect with. And I connected with Susan Hallback, and then I connected with you, and little did we know that it would evolve into a partnership, but it did, and I'm glad it did, and here we are. So maybe you mentioned it and I might have missed this, but where in your training, you started out as an occupational therapist. When did you then do your ergonomics training and become a certified ergonomist, or was it at the
So
same time?
no, it was like in my master's degree, I actually went through environmental design at the University of Calgary. And then
Hmm.
I knew very specifically at that time because I'd taken some industrial design courses and
Ah,
economics courses. And I actually did a project that looked at how we could embed education back into a lumber mill, and really how could they actually start changing the work through their
hmm.
teams. And it was a team-based ergonomics intervention. So that's really where I got my majority of my ergonomics training. And then I got more actually in my doctorate when I went through Boston University under Dr. Karen Jacobs as well.
Got it. Okay. Now I see the timeline. All right.
It's a long
So
time.
yeah, well, for all of us, right? I mean, it's lifelong learning and it's a passion. So,
Yes.
that I don't think the time matters as long as you're having fun and learning new things.
Yes.
Yeah, so for our listeners, I do want to say that I specifically asked Linda to come on today's episode because we want to discuss a topic that comes up very frequently during our coaching, and it's an important one, right? Linda, I've always heard you and other ergonomists and experts say good ergonomics are built from the ground up, right? And surgeons and other healthcare workers in the operating and procedural spaces, nurses, scrub techs, etc., were standing for long periods of time. So, what we want to talk about today is what can we do to mitigate the risks of injury when we're standing for these periods of time. And specifically, I want to address one of these things first, which is anti-fatigue mats or cushion mats. So for those who have never heard of these, what are anti-fatigue mats and where are they used in work environments and why?
So anti-fatigue mats are actually designed as a cushion matting, and they have lots of different characteristics based on the environment it's going in. So some will be very specific to very heavy labs, and others might be in kitchens, others might be actually in a surgical OR. And so they'll be designed so that it provides some cushioning, but it also might have other features. So it might have anti-slip. It might also have features to create a little bit more instability. So there's lots of different types of anti-fatigue matting, but the goal is to provide cushioning. So it typically
Right.
is designed as a cushion mat.
All right. Now, I had an anti-fatigue slash cushion mat in my kitchen, right? Because I love to cook and I'm standing there in front of the stove and sometimes the floor is cold. And so I like the cushioning it provides. And so I remember when I was sort of delving into ergonomics and the use of anti-fatigue mats in hospital spaces, I actually looked at the OSHA website and specifically where OSHA recommended use in hospitals. And it had these two criteria. It said where workers are standing for long periods of time and where there are slip hazards, as you said, where there are fluids. Now, to me, both of those things apply in the OR, yet anti-fatigue mats aren't typically used in procedural and OR areas. So why is that? Why haven't those mats they've made inroads into our kitchens, into our bathrooms. They're widely used on the industry side. why haven't they been adopted in procedural areas in healthcare settings?
It's a great question because, first of all, like anti-fatigue mats have been around for probably 20 plus years, and
Mm-hmm.
we've seen them all across industry. I think there's this perception that they're hard to clean and they might not be
Mm-hmm.
suitable for an OR environment. But that's actually not the case because there's actually anti-fatigue mats, like I said, that have characteristics meant
Mm-hmm.
for that environment that you can autoclave them, you can wipe them down. So I think it's really trying to almost start to address this narrative that maybe not truly there.
Yeah, I think one of the other sort of things I've heard from some of our, whenever I've given talks or when we've coached people, we've come across this too, that people have tried to get mats into the OR, and then there are the actual concerns that you outlined, but also, well, there are concerns about infection prevention, and are they associated with a higher risk of infection, hence kind of the cleaning issues. And then the second piece comes down to, well, is it an additional hazard for the workers? Now they have to bend down, pick up the mats, clean them. Where are we going to put them? All of these things. So, how do you address those things in industry, and how can they be addressed then for the OR environment?
Well, and even if you take a traditional industrial kitchen, they have to be cleaned daily. And
Mm,
it's, again, having a protocol of how you're actually going to move forward to clean them and actually lift them
mm,
and move them out of the way. And so it's really about developing the protocol for cleaning rather than saying that it's going to create an injury, because we don't necessarily see that in industrial kitchens and we don't see that in
mm,
labs. But it's part of the cleaning protocol and how people are going to actually approach the task and literally lift and move the mat. And we're not talking like a lot of the kitchens that we go into, they'll have
mm,
mats that run the entire length of a counter. In most cases, the mats that we see in the OR are maybe 24 inches in width or maybe
mm.
36 at the most. So they're not super big in terms of size, but they allow people to still have the opportunity to move around and stand. So we're not dealing with the same weights even as a lot of
Yeah, yeah.
these like labs and kitchen environments where we do have much longer runs of the anti-fatigue mat even.
Agreed. At least the ones I've seen in the operating rooms are not like the ones you see in industrial kitchens
No.
and things like that. So that kind of brings me to another question, which is what is the evidence behind the use of anti-fatigue mats in industry as well as in OR procedural spaces? I mean, does it actually reduce risk of musculoskeletal symptoms and injuries, or is it just like, oh, it feels good, so we must use it?
Well, that's been a really interesting question that people have asked. I've heard a lot of people say, is it no different than just having a pair of cushioned footwear?
Yeah.
So it was interesting one study that was actually done in a surgical environment where they actually followed about 38 surgical staff, and they looked at the use of anti-fatigue matting and the use of cushioned footwear, not just the use of cushioned footwear in isolation. And they
Hmm.
actually saw a difference. So they saw a difference in fatigue, and they saw a significant difference in pain and discomfort. And what was interesting, it wasn't just after the procedure, it was actually sustained 24 hours even after that procedure. So I think it's
Wow.
interesting that having the cushion matting plus having good footwear actually is more protective when they're working together.
I see. Okay. So, when it comes, just to kind of summarize our discussion so far, when we're talking about building ergonomics from the ground up and foundation, because we're standing in procedural areas on, hard concrete floors, cushioning is important, but the benefit of these anti-fatigue mats or cushion mats goes well beyond just the cushion feeling, right? There is now data
Beyond.
and studies
Yeah.
to show that they reduce the risk of musculoskeletal symptoms and fatigue, and that effect seems to last actually beyond the duration of the surgery itself. And
Yeah.
to me it seems like a relatively cheap intervention that can
Mhm.
be hardwired into OR work environments, just like our sterile instrument trays and foot pedals and other things show up, anti-fatigue mats could come to every OR or be available in every OR. And so people can use them and try them out for themselves.
Well, and the other thing too is it benefits everybody. It's not just for the
Right.
surgeon, it's for the whole surgical team. And I think the other thing that's really important is when we're looking at the surgical environment, a lot of the surgeries can take a significant amount of time where they're in a standing posture. And it's
Mm-hmm.
not as simple as say, can you take a break and sit in a chair? Well, it's not that simple. And yes,
Right.
people are work hardened to standing, but the
Yeah.
benefits and this study specifically actually look at not only the feet, but into the lower back as well. And
Yeah.
so it had an effect on the whole body.
Well, that's fascinating to hear. Okay. Well, so for those of our listeners who are interested in using anti-fatigue mats, I'm going to include a link to the study that Linda and I just discussed so that you have this data about, use of anti-fatigue mats. I urge you to involve your infection prevention colleagues early because often that becomes kind of, I should say, a potential barrier. And so it's important that you have sort of the procedures for cleaning these mats and other things handy. And maybe you need to get, things that are autoclavable for your hospital, depending on kind of your local, infection prevention colleagues and their requirements.
Well, and the other thing too is if you can get them involved early, also when you're looking at stools, then you can also get anti-fatigue matting that's actually the right size for step stools as well. And so the nice thing is you can have it for the floor, but also for those people that have to use stools, there is matting for stools as well.
That's right, Linda. Thank you for bringing up that point. That's a really important one, and actually one that has come up in our coaching sessions because I think we've heard a few clients here and there say, well, our hospital has anti-fatigue mats, but I stand on a stool, so I don't use them. And the key point is that, there are various suppliers, and you can actually get anti-fatigue mats that are beveled and fit on either your existing stools, or those companies could provide you with stools with kind of built-in cushioning. And so
Yeah.
just because you're standing on a stool or a lift doesn't mean that you can't use anti-fatigue mats. Correct. Okay, well, on the topic of then continuing to build our foundation, now you mentioned cushioning footwear. So when you talk to surgeons, there's going to be, or even I should say, not just surgeons, but nurses and scrub techs, there's going to be two schools, I think, of types of footwear that people utilize. There's going to be team running shoes and
Yeah.
team clogs.
Yeah.
And I'm going to say for my entire career, I've mostly been team running shoes, even when I was a resident. I think for a brief duration of time during fellowship and early attending years, I tried out different clogs and decided that they were not for me. Now, I made that decision without any data, but I'm going to ask, your expertise as an occupational therapist and a certified ergonomist, what is the best kind of footwear that people in procedural areas should be using to help mitigate some of the risks of musculoskeletal injury?
So what's really important when people are actually making the decision, it's around what is the task. And so for some people that actually find that they are comfortable in clogs, clogs have come a long way with cushioning and support, and they have been designed for standing as well as a running shoe. They're not always the best though if you're now going to have to go outside of the OR or walk around in the OR. And so I always tell people that there are options. You can look at clogs, you can look at running shoes. They're really about the fit and comfort for you. But in outside of the OR, I would actually always suggest more of a supportive like footwear like a running shoe.
And if they wanted to use running shoes, one of the sort of barriers becomes, if you're in a specialty where there's a lot of, I should say, fluid involved.
Yeah.
So, trauma surgeons, obstetrics and gynecology, urology come to mind. That's kind of a big reason why people gravitate towards clogs because you can easily clean them, wash them off, get
Mhm.
plastic ones. And the criticism for running shoes is that then, well, they're not, as easy to clean. Do you know that there are running shoes that might fit those criteria?
Yeah, there definitely are. So there are Gore-Tex running shoes. There are lots of different styles that are coming out all the time that are easy to clean. And I
Hmm.
always want to remind people that this is you're often spending a significant amount of time standing or walking. And so having a really supportive type of footwear, and specifically now when we talk about running shoes, it's something that's no different than you buy a pair of running shoes when you're running or walking. You want to make sure that they're, first of all, comfortable and they fit properly. And then you will always find options that will allow you to keep them clean in that type of an environment. So it's
I
fit and
see.
comfort that are critical. And then there are always options to find where there are options to keep, footwear clean and easy to actually clean up after.
Right. Okay. Now, some people, I think, and myself included, I have to say, I've been using shoes to not for running or walking, but I've been using them in the gym for some time. And now I want to get a new pair of shoes for the gym. And so I'll say, well, I'll take these running shoes to the operating room to stand in. So is it okay to move kind of an older pair of shoes to the OR environment, obviously after cleaning them? Or would you suggest that people get a dedicated new pair for the OR, and
I
keep them
would
separate for their tasks?
And thank you for bringing that up because I actually would recommend them to have their own pair specific for the OR because you
Hmm.
will have specific wear patterns to the other activities that you do if you actually bring an old pair in. So if you ran in them or you were walking consistently in them or even using them in the gym or for maybe a racket sport,
Right, right.
the shoes will be based on that sporting activity. And it can actually affect how you're going to stand effectively in the shoes. And I can
Hmm. Hmm.
guarantee the cushioning actually probably isn't that great anymore.
I see. Do you have any tips and tricks for people looking to purchase new sort of running shoes or clogs for the OR? And then are there guidelines on how often they should be changed or switched out? How long can you use them for before they're not providing you the support you need?
Yeah, so those are both two great questions. So the first thing I always tell people, try and go and buy your shoes in the afternoon, like when you've been up working, you're not going and buying the shoes in the morning because your feet will swell. And the other thing that's really important is if you've ever been given a cushion insole or you've been prescribed orthotic, you always need to take it along in order to actually make sure that the shoe fits with the orthotic and it's not going to end up being too tight. So
Hmm.
those things are very important. And then when you start to look at a running shoe, you want to make sure that it fits well. You can actually move your feet, you move your toes. You still get support for the heel. But when you can lace it up, you feel that you've got good support around the foot. You don't have your foot
Hmm.
feeling like it moves quite significantly in the running shoe. Now with clogs, it's a little bit different because your foot will move a bit more.
Hmm.
And the bigger thing that I would look for is again making sure that you're going and purchasing them in the afternoon. Make sure that you're actually standing in them for a little bit just to really feel how they actually fit the foot.
Hmm.
And
Hmm.
make sure that you get some support. And I know that a lot of the clogs now you're getting more and more designs that are supporting the arch in the foot as well and giving more
Hmm.
cushioning. But you really do need that support. You don't want your foot to be moving a lot in the clog that you don't feel like you get adequate support. That's why we often don't recommend these plastic type shoes. And I'm sure people remember the ones that people would garden with and they'd slip in. Well, they actually were
Yeah,
associated with a lot of injuries because people would slip, they'd fall.
I
And
see.
yeah, they felt cushiony and comfy, but they provided very little support for the foot.
Okay. Yeah, certain plastic clog comes to mind. I guess the holes are not useful for providing any sort
No,
of waterproofing either. So
no.
be mindful to try and not get ones with lots of holes. And
And
then
then
how often should people change them?
so that's really dependent on the use pattern. So like,
Okay.
and I often refer to running because I used to run a lot. Some
Hmm.
people
Hmm.
could get a year out of their running shoes based on the amount of mileage that they put on. Other people would be blowing through a pair of shoes within 6 months. But what you want to be able to do is look at your footwear periodically and just see if there's starting to be wear patterns. And if you're starting to see the tread start to actually get so it's not really definable. And
Hmm.
you will see specific tread patterns. I find that most people are looking at it 9 months to 12 months because you're walking a lot, you're standing for
Hmm.
a good portion of the workday. And we often think about buying a really expensive pair of shoes for going out and enjoying an evening out. But we have to think about our feet as we need to protect them and we need good footwear that's actually supported and giving us that cushioning.
Right. Good, all good points, Linda. I am going to circle back to something you mentioned just a couple of minutes earlier in this discussion. You mentioned if people have, orthotics or have been using cushions that they make sure to take them when they're going to get fit for new shoes. How does one figure out whether one needs orthotics? Because, I mean, it's different if you were born with a foot deformity. Like, for example, I know I was born with, flat feet and I had those sort of metal molded shoes that I wore in childhood. I think it was, I stopped wearing them when I first entered school, kindergarten. And then, no one told me I needed to wear orthotics, etc. And I actually went to get fitted for a pair after I was having all these issues and pain from standing in the OR. So, how can our listeners figure out if they actually do need custom orthotics? What are some of the things they should be looking for?
So, first of all, if they are having any discomfort or pain that's associated with their feet, I would definitely get a referral to a podiatrist or a
Hmm.
physical therapist that's trained specifically in the feet.
Hmm.
And
Hmm.
they can actually assess your feet and actually assess not only if you require orthotics, but are there other interventions that should be actually introduced as well, such as stretching, such as maybe even massage, in order to
Hmm.
actually start to address some of the issues associated with standing in one location for a period of time. And
Hmm.
so I always believe going to a professional that is trained actually to evaluate your feet because our feet are all different. And
Hmm.
we will get very good advice around if we actually need an orthotic that's custom or if we
Hmm.
just have to look at some form of a cushioned insole.
Okay. So let's say somebody's gotten anti-fatigue mats, they've got fitted for good shoes, and they're still having discomfort while standing and doing their job. Is that perhaps a clue that they should look at picking up something from, their local pharmacy or go see someone to get orthotics? Would that
My
also be kind of
my preference would always go and see actually a
okay?
podiatrist or a physical therapist because there might be more going on. And you
Mm-hmm.
want to make sure
Okay.
that you're addressing your feet early. And
Right, right.
sometimes it's interesting because I look at all the other things that we do, dental care,
Mm-hmm.
musculoskeletal care, but there's not a lot of focus on feet until
Right.
often, things have been impacted significantly, but that's our base.
Indeed. Yeah. I was just thinking that it's our foundation. So yeah, we need to take care of our feet just like we take care of the rest of our body. Okay. Now, Linda, I do want to take a few minutes to talk about the culture of surgery surrounding anti-fatigue mats because I remember the first time I asked for anti-fatigue mats, I was told, well, you want the princess pads. And I know having given talks, multiple talks for the past few years, and, in our kind of workshops and master classes that we have done together for various societies, this comes up a lot. I'm not the only surgeon who has heard, oh, you want the princess pads.
Yeah.
So my personal view is that this sort of language is harmful in two ways. It's harmful for the person who's asking for them because nobody wants to feel like they're asking for special accommodations and that they're being a diva or a princess, particularly female surgeons. The female surgeons and trainees and who are our listeners will understand what I'm talking about. But I also feel like it does an overall disservice to surgeons that could benefit from standing on anti-fatigue mats. When they hear this sort of language, they are discouraged from asking for them. So what are your thoughts as kind of somewhat of an outsider, as an ergonomist, about the language that we use? Do you see this in industry, this sort of language in industry as well?
We would have saw that language years ago. I think we see
I
it
see.
less because it's in the culture now that, like, for instance, I used to have people say, well, why are you using a piece of lifting equipment? Just go and do it.
Mm, mm,
Well, the culture of safety, health and safety has really changed, and you have it
hmm
from the
hmm
top down saying, no, we actually have the tools. We need you to use them in order to protect yourself and go home safe at the end of the day. So
Right.
the language we use often will dictate if people will actually move forward with those controls.
hmm
And
hmm
if people are seeing, like if you're that, I'm going to use your example of a princess pad, then it actually affects not only the person that's asked for it, but it's the person that maybe they have a foot issue. It might be
Right.
also a person that has used it in another environment and they go, it's really helped me. And all of a
hmm
sudden now they step back from using it because that language it almost acts as a barrier.
Right. So this is, I think a plug from both of us, from Linda and myself, because as I said, we run across this in our coaching, is that we should use the language that comes with these mats, which is anti-fatigue mat or cushion mat rather than, princess pads and, various other sundry terms that come with them. And for surgical leaders and OR leaders, having these available for everyone so that using them is the default option will
Mhm.
go a long way to reducing these barriers. And, Linda, I will say one other thing. When I was sort of researching the use of anti-fatigue mats, 2, 3 years ago, I noticed that when I look at the Association of OR Nurses website, at least at that time, they actually had an article or a paper that recommended that the use of anti-fatigue mats in the OR for nursing staff to reduce the risk of musculoskeletal injuries, particularly back pain and back-related issues, other back-related issues. So it's interesting that we have nothing for the longest time in the surgical literature, but there has been discussion about it in the nursing literature and specifically the AORN. And so I think it's time for surgeons, nurses, techs, all of us to advocate for the use of these mats in our workspaces so that we can all improve our musculoskeletal health.
Yeah, absolutely. And it's interesting. Like I said at the very beginning, I
Yeah,
did a lot in healthcare at the very beginning of my career, but it was always around nursing. And I was,
yeah.
the pharmaceutical side or the pharmacies, lab techs. And
hmm
I really didn't get a lot of exposure to working with surgeons until about 5, 6 years ago. So
Yeah,
it tells you a little bit where the culture of safety has really started and where
yeah,
it's
yeah.
continuing to move.
Right. Well, at least I think I'm heartened by the fact that we're talking about this issue and, taking active steps, slowly but surely. I think at some point we will catch up with industrial engineering side of things, but for now, you're right, we're very behind. So in the last few minutes before we wrap up, are there things that I haven't brought up or we haven't had a chance to talk about? For example, some hospital spaces, OR spaces use, I think, cushioned materials on the floor in the operating rooms as opposed to concrete floors. Is there a role for that? Should healthcare facilities be looking at those things, and how useful are they?
So the one thing is that there is flooring that provides a bit more cushioning, but remember it still has to have a density enough so you
hmm
can move equipment. So it may not have enough give to it
I
in order
see.
to get really true cushioning. And so I think there's still a role for the anti-fatigue mat with some of the cushion flooring, and because it still has to be fairly hard so that we're not going to impede movement of equipment.
Got it. Okay, so for our listeners, remember, I guess this is just like the rest of ergonomics. This is all about the Swiss cheese model, right? You need multiple layers of intervention. There's no single silver bullet, and certainly no single intervention works for everybody. So we need a combination of things. Well, Linda, I see that we're almost to the end of our time today, and I really want to thank you once again for being here this afternoon and sharing your time and expertise with listeners of our podcast. I think we might get a lot of follow-up questions about this. If it's okay with you, I will include your contact information in the show notes, as well as I mentioned earlier, the article that we discussed about anti-fatigue mats. And maybe your tips and tricks, as you mentioned, when people go to get their shoes fit and how often they should change them as well. Please remember to subscribe to the podcast and follow us on social media, Instagram, X, Facebook, and LinkedIn. We love feedback, so please reach out to us for topics, ideas, speakers, or if you ever want to be a guest on the show. Thank you for listening.